Does fibromyalgia qualify you for disability benefits? Hello, I'm Mark Whitehead, a board-certified disability attorney and author of the disability help books, The Social Security Disability Puzzle, Disability Insurance Policies, How to Unravel the Mystery, and Veterans Disability Claims, Strategies for a Winning Campaign. Fibromyalgia is a chronic disorder that affects about 5 million Americans. Patients suffer intense pain and aching in the muscles and soft tissues throughout the body, including specific tender points. Symptoms also include fatigue, cognitive dysfunction, irritable bowel syndrome, and depression or anxiety. The exact cause of fibromyalgia is unknown and may involve different factors that, when working together, affect the way the brain processes pain. Events or conditions that are likely to trigger fibromyalgia include genetics, emotional and physical trauma, and certain illnesses or infections. While fibromyalgia does not damage the joints or organs, the constant pain and fatigue inflicts a devastating impact on daily life. Although the pain associated with fibromyalgia disability is real, there's no lab test or x-ray to measure the findings of fibromyalgia. Doctors diagnose fibromyalgia based on the patient's symptoms and physical exam. For this and other reasons, getting approval for disability benefits from the Social Security Administration, the Department of Veterans Affairs, or your long-term disability insurance plan can be problematic. If fibromyalgia prevents you from working, you may well be entitled to the Social Security disability benefits. However, winning disability under the Social Security Administration's disability program can be difficult. The SSA Blue Book, which is the Social Security's reference manual containing the approval of medical listings for specific impairments, does not even include fibromyalgia. Since there's no medical listing, the Social Security examiner will attempt to equate your disability with an existing medical listing. They will also consider and give value to accompanying impairments that may be involved, such as osteoarthritis, degenerative disc disease, or lupus. However, the determining factor for qualifying for Social Security disability benefits is whether fibromyalgia or any other impairment affects your ability to work. Long-term disability insurance benefits for disability based on fibromyalgia are available under most policies. However, many insurance companies are unsympathetic toward policyholders who submit claims based on fibromyalgia. Insurers tend to view these claims with skepticism. Common reasons for claim denial include characterizing the fibromyalgia as treatable, or without specific diagnostics to show cause, there's no reason to consider you physically disabled from doing sedentary work. Insurance providers often lead you to believe that your case is defeated and you'll have no alternative. They will apply misleading tactics using their own medical records or vocational evaluations to dispute your claim. They may delay the process by not responding or making continual additional demands for information. They may even hold out until forced by the court to give you the benefits that you're entitled to. Veterans can claim disability based on fibromyalgia if they can prove it was connected to their service in the military. The Department of Veterans Affairs Schedule for Rating Disabilities lists the evaluation criteria for fibromyalgia under the musculoskeletal system as diagnostic code 5025, fibromyalgia. Disability claim approval and rating levels vary according to the several criteria, such as whether symptoms are widespread, on both sides of the body and above the waist, or constant or episodic, or require continuous medication. Any disability, including a mental disorder that is medically determined to be secondary to fibromyalgia, can be separately evaluated. With over 700,000 U.S. troops serving in the Persian Gulf beginning in August of 1990, countless veterans came home with symptoms of muscle, joint, and bone pain, debilitating fatigue, memory, and thinking disorders, emotional distress, and other symptoms indicating fibromyalgia. As of 2009, the VA identified fibromyalgia as a presumptive disorder for Gulf War veterans who meet the criteria of the VA Schedule for Rating Disabilities. These veterans do not need to prove a connection between their military service and fibromyalgia in order to receive veterans' disability benefits. Although fibromyalgia is considered a Gulf War presumptive illness, securing disability compensation can be tremendously difficult. Many veterans who served in other locations are also disabled by fibromyalgia. For more information, download one or all three of our free ebooks, The Social Security Disability Puzzle, Disability Insurance Policies, How to Unravel the Mystery, or Veterans Disability Claims, Strategies for a Winning Campaign, by visiting www.disabilitydenials.com for a free downloadable copy, or call 1-800-562-9830 to discuss your particular disability issue. I'm Mark Whitehead. Thanks for watching.